In this video, I'm going to be talking about how is it possible to get rid of anxiety and panic attacks in only a few weeks. Hi, I'm Wahida Finley. So this video is based on my experience working with anxiety and panic attack clients for the past 12 years. Now, you might have had anxiety and panic attacks for many, many years. You may know the cause of it, you may not know the cause of it. Most clients come to me when they've had lots and lots of therapy. They've had talking therapy, counseling, just talking about it. They've tried CBT, so managing their thoughts, their emotions, and trying to change that. They've tried distraction techniques and breathing techniques. Now, the problem with all of these are that they are trying to work on symptoms. If you've spent lots of time and therapy dealing with symptoms, trying to figure it out, this is why it's not better. You haven't made an informed decision, or you've spent loads of money on therapy where they're just trying to calm down your breathing. Now, if someone doesn't see anxiety clients all the time like I do, they're seeing someone for nail biting one day, weight loss another day, and then a bit of anxiety. Like most people, they think anxiety is just a fear response where their heart is beating fast or they're getting anxious and they need to calm you down. Even hypnotherapists try and calm you down. I see lots of clients that have had hypnotherapy. They get given something called suggestion hypnotherapy, where they put in a relaxing position, they close their eyes, and the therapist just talks to them and says nice things, you know, calming things. Your brain will feel calm, or you will feel calm. They say stuff like your fears or your anxieties floating up in the clouds. Now, that's not going to make it go away. If you're doing that sort of therapy, believe me, people that have gone to hypnotherapists, they have that. They put whale music on, or hypnotherapy isn't actually regulated in the UK. I belong to a professional organization called the National Council of Integrative Psychotherapists. So we can choose to belong to bodies where we have a code of ethics. Now, most hypnotherapists or people that do hypnotherapy think we just need to relax people, and they think hypnotherapy is about relaxation, and that's what they spend their time. And I've had clients go for like 6 months to a year of hypnotherapy where someone just tells them they're calm on a beach or something. Now, do you think that's going to make your panic attack go away if you've seen a dead body, or, you know, you've had a miscarriage or something like that? So no, it isn't. It isn't going to get rid of trauma. It's not going to get rid of anything by doing that. Even talking about it, if you know you had a trauma, someone raped you or attacked you, you know, just talking about those feelings is going to help you understand the feelings and come to terms with it. But chances are these sort of talking therapies, if you've had a proper trauma, they are re-traumatizing, and you just talk about it all the time, but nothing changes. Your anxiety levels don't go down and your panic attacks don't go down. And that is because they're just talking about it and nothing's getting done at a brain level. The other thing is they're not getting rid of the cause. They're just trying to calm down your breathing, like blowing a bag. You know, if you're rolling on the ground, having a panic attack, feeling frightened, if I told you to count something, smell something, touch something, find a pink thing, find a green thing, find a yellow thing in the room, and you're rolling around in pain or wanting to call an ambulance, it's too late. It's too late to do these distraction techniques, these CBT techniques are really outdated. They're from 1956 or 76 or something like that. They're really, really old fashioned. Something the NHS decided that was a good idea. There are modern ways of doing it, rapid ways of working with the brain that can help you get rid of them really, really fast. They don't work. They're not permanent. If you did yoga today, it would calm you down and make you feel good. If you went and had a massage, it would make you feel wonderful. You could go and sit in a spa or in a jacuzzi or something, or in a hot tub in the garden. You'd feel really nice. But an hour later, you could still get a panic attack. Okay. That means that the nice, cozy feeling you get when you're having those experiences are really wonderful when you do it, and it makes you feel good. But then an hour later, 2 hours later, all the panic and fear happens. That's because your brain is always at this up and down cycle of fear. It hasn't fully released it, and your brain is in this fight, flight, or freeze. It's in a high alert mode, and you can't get rid of it. And if you just focus on breathing and calming techniques, you're just sticking a plaster over it. You're not dealing with the cause. You're just dealing with symptoms. So one of the symptoms of anxiety and panic attacks, or anxiety, for example, one of the symptoms is like churning stomach, or people get tight stomach, or they need a toilet. Okay, if you took Imodium just to calm the toilet down, it's not going to make the anxiety go away. You'll just need Imodium every time you go out. Or if you felt sick and vomiting all the time and you need sweets, you know, sour sweets or whatever, just to stop you feeling sick, then all you're doing is masking the sick feeling with these sweets. And if you didn't have the sweets, you would still feel the anxious, sick feelings. So the whole purpose of it is stop using these controlling techniques and masking it, and even medication. They're all masking it, and they're not actually dealing with the cause. They're just dealing with symptoms. This is why you're not better. Even if you spent thousands of pounds, lots of my clients have spent thousands of pounds with psychologists that are just trying to guess, psychologists that are just talking about what things have happened. If you've had lots of traumas, imagine if you're 70 and you've had lots of traumas throughout the year, parent dies, relationship breakup, job loss, you know, frightened of being retired, losing your home, anything like that. If you've had so many, how would you identify what it is that's causing the fear response in your mind? How would you know? You're just guessing. You're just going to have to go for weeks and weeks of therapy. And a lot of my clients go for like 26, 30 weeks of therapy. They spend over £3,000 just talking about it, and they're not better. So the best way and the fastest way, in my experience, because I help people in like within 3 or 4 weeks, and is to deal with it at the cause. So we find out what happened. I don't need to go into detail. I don't analyze it. I don't like look at every spec. I don't need to know all the detail. I just need to know, you know, if someone died or something bad has happened. Some people just say it in their head. They say, well, I know what it is, but I don't want to talk to you about it. I say, okay, as long as we know what it is, so we can make it go away. So yes, I'm using hypnosis. I'm using a bit of hypnosis. I'm not calming anyone down. We could do them standing up at a football match if we needed to. It's not about calming down. It's about accessing parts of the brain that are holding onto the fear, allowing it to let go so it no longer bothers you again. And then I also use some of the other techniques like EMDR, bilateral brain stimulation, various techniques where we can peak the fear response, knock it out, and then let the brain know it's safe so that it goes down to 0. So we can get people with a level 10 fear, go down to a 7, go down to a 3, and then go down to 0, and then we never have it again. And the reason why it takes 4 weeks is we do 3 of them close together, but then we leave a testing phase, which can be a couple of months if we need to, where they go off, and we want it to be permanent, right? You don't want to feel better just for a few weeks working with me. You want it to be permanent. And I know that it is permanent because people come back to me months later to do their final session, or they'll send clients to me, you know, years later, because I know that they're still better, or I bump into them somewhere and I know that they're better 2 years later. They're still going on the plane or still free of anxiety. So that's how we can get rid of it really quickly. It doesn't have to take 6 months or a year of therapy. Even if you've had it 10 years, even if you've had multiple panic attacks and multiple traumas, it's about releasing it from the brain at the cause, not dealing with the symptoms. So thanks for watching. I hope that helps you understand a bit more. In the next part 9, we're going to be talking about rapid change. What is that? Let's see. See you then.